So I'm Virgilio Matheus, a neurosurgeon, fellowship trained in complex spine surgery. Been in practice for a little bit over 10 years, practice in Florida. I've been a part of the REMI committee for NAS. NAS created a committee that is called REMI, that stands for Robotics and Enabling Technology and Minimal Invasive Surgery. Had the pleasure of helping that committee for several years now. And that's how we like to bring experience from different backgrounds, different surgeons using different platforms in robotics, so we can help advance the field for all the other surgeons. And we're going to be talking today about the use of robotics in spinal surgery. It's a little bit over around 1,200 cases we have done so far. So we wanted to share our insights and some ideas of how this technology can help the surgeons practice.
Mm-hmm. My name is Ashley Botsford. I'm a PA in neurosurgery and have been working with Dr. Matheus for over 9 years with focus on dedicated spine surgery. So, okay. All right, let's get started.
Yeah.
So what first motivated you to incorporate robotics into your surgical practice?
Great question. So back then, it was probably about 6-7 years ago, I was looking into the new technology coming out, and I've always been a little careful, hesitant of adding new technology too early until it's kind of proven. That being said, robotics in every industry that has entered outside medicine have created a dramatic change. It's been very impactful and have not had to be withdrawn from that field. So I didn't see medicine being the exception, and to prove it, many other specialties before spine surgery were using robotics with positive change. So at that point in time, I thought that it was reasonable to explore how robotics could make my practice a little safer, easier, faster, and that got me going into the whole research and eventually getting going our robotic program.
Okay. And how long have you been using robotics?
So we started in 2019, as I mentioned, done about 1,200 cases so far, and going.
Okay. How has robotics improved the accuracy and precision in spine surgery?
That's very interesting. So we as humans, we're prone to human error, and as much as we surgeons don't like to admit it, we have sometimes misplacement of screws. Obviously, the experience and the accuracy from handheld or free-handed screws without navigational robotics comes at the expense of a lot of experience, which involves having misplaced screws. There's significant issues with the misplaced screw, from the structural stability of the construct, possible neurological issues, damage to the dura, the thecal sac. So this technology allows to a very predictive way provide very accurate placement of instrumentation, and it's very repetitive. So it's not only the high accuracy, but it's anticipated repetitiveness of the technology. So Ashley, why don't you tell us a little bit from your perspective how you see or believe robotics have changed or improved the workflow in the OR when we do these cases with this technology?
So with use of robotics and having kind of these pre-planned trajectories and placements of screws and how the overall procedure is going to entail, it allows us to have more repeatable structured sequence of events, which helps facilitate just the overall workflow from the rep involvement to the surgical tech to the assistant, and then ultimately overall balance of the surgery.
Okay. Ashley, can you tell me of any cases you can think of where robotics have been impactful, make a big difference on achieving a good result in that case?
I mean, I think in general for most cases, any MIS procedure, any minimally invasive surgery, with having the ability to kind of pre-plan, you can make smaller incisions, which is better for patient outcomes, you get less wound infections. So I think overall with having that capability, it allows for, accuracy with planning. Also, it allows us to kind of work simultaneously, which is fantastic. So in our bigger deformity cases, you're able to do more of the lateral procedures as I'm exposing the posterior aspect. So that helps facilitate in efficiency and shorter OR times.
Yeah, absolutely. And in those cases, we use the robotic technology to help with the navigation platform and also for controlling the retractor, which in those prone access cases, we all know gravity tends to have the retractor skive or go down quite a bit. These robotic arms are extremely strong, and not only provide the tool of the navigation, but also a very sturdy control of the retractors. Other cases I can think of where robotics has been very impactful is when we do revisions. So when we do revisions, obviously the anatomy has changed quite a bit. And it's not unheard of that there are no landmarks, and you got to rely on use of a lot of fluoroscopy, so you can figure out where the screws are going to be placed, and this results in very high exposure of radiation for the whole surgical team. So a lot of revisions, the robotics helps. I think a lot of cases where it's been very helpful is when we do fractures of the lumbar or fusions of the lumbar pelvic spine, and there's a previous instrumentation from pelvic fractures. The real estate is very limited about the space where we can put those screws or that hardware into the pelvis. And what I used to say, or what I like to say, is that if you can plan it, you can do it. So you can have a very small margin of error and actually deliver that plan where you can place screws in between previous hardware from other surgeries or other specialties. I think in some of those revisions, one of the things we surgeons fear the most is having to remove the previous hardware, which can be time consuming and has its own challenges about stripping of screw heads, things like that. With use of robotics, we have been able to either plan hardware at the adjacent levels without having to remove or explore that previous instrumentation. In some cases, even being able to add other screws at the same levels where instrumentation has been placed, allowing for a much quicker time in the OR for the revision, decrease the blood loss, which is all for positive results for the patient. I think that you mentioned a little bit on minimal invasive. With the robotics, we have noticed things that were not really involving the decision planning of these cases. Simple things like one-level spondylolisthesis. We used to focus on things like just place a screw in a satisfactory, good place, which you can do for most cases with either experience or with the use of fluoroscopy or even handheld navigation. That being said, when you can use the robotics, it allows to pre-plan what you're going to be doing, and more importantly, deliver that plan very accurate. And this allows to anticipate screw height discrepancy, so you can do better reduction of the listhesis, even anticipate the angulation discrepancy between the screw heads, which allows for a more offset of the rods to improve the reduction of the listhesis. So skin incisions, you can extrapolate the screws all the way from the spine into the skin and anticipate how small is going to be the incision, which decreases soft tissue disruption, infection, blood loss, length of stay. All those things have been very helpful in our practice. Ashley, can you tell us a little bit about how do you see or feel that robotics can help or enable that hands-on experience or involvement of the physician assistant during the surgeries for spine with robotics?
Yeah, so of course one of the fears with being an assistant in the OR is that with integrating robotics, that my job or my role would become obsolete or I'd be less involved. And I think actually it's allowed for more involvement throughout the case to, the workflow setup, system setup, patient registration. We can assist with accuracy check, robotic arm movement, with experience and guidance with actual placement of screws, which I think just overall, we're able to be involved from the beginning to the end and, a little bit more participatory throughout the case.
Yeah, and that's key that out of the hundreds and hundreds of cases we have done, I know you have been with me in the vast majority of those cases, and when you look at the literature, they clearly support that accuracy of placement of screws in the spine with a robotic platform doesn't have much of a discrepancy between a very seasoned, experienced surgeon compared to a kind of novice or early career practitioner with a very small learning curve. So after participating in anywhere between 25 to 50 cases, I see this over and over every year with my residents and physician assistants. After close supervision, they can safely and easily participate in a screw placement with supervision of the surgeon, which actually allows them to be more involved, more hands-on than what it used to be pre-robotics.
I think ultimately that just helps with learning.
Absolutely. So what would you say is the common misconceptions in robotics, or if you see someone who is hesitant in their team to adopt robotics into spine surgery, what would you tell them?
I mean, I think that overall with a quick learning curve, it actually helps with workflow, accuracy, precision, and then just the overall, case and outcomes.
Great point, and for many physician assistants or nurse practitioners who fear that adopting robotics is actually going to exclude them or keep them out of the OR or hands-on experience, is the opposite. I see a lot more involvement when robotics is included. From the surgeon perspective, a common misconception is that robotics is going to slow down or delay the case, and the surgical time is going to increase. Once you have a well-oiled machine and a team that knows what we're doing, clearly, actually, the surgery is going much faster. There's a clear anticipation and predictability about the steps to follow. So I think that's a very common misconception.
It's very streamlined. So overall, what would be your take on robotics and implementing robotics into your practice for somebody who's...
I think robotics is here to stay. I think that robotics is going to continue evolving and including more aspects of the spinal surgical intervention. I think it's going to migrate from just screw placement and software for planning to things like bone removal. I think osteotomies, laminectomies will easily be performed with assistance of robotics. I think is just imminent. That's probably in the short to mid-term. I think in the long term, robotics is going to assist with more complicated things such as incision, wound closures. I think these technologies will also evolve to have or allow for the surgeon to do multiple steps of the surgery with their assistant simultaneously. So I think this technology is definitely here to stay, and it's just going to continue evolving.
Awesome. Thank you.
Thank you guys for watching.